All right, guys. So, welcome to tonight's mastermind. Lovely to see everybody as always. Really nice turnout tonight. So it's good to see everybody. Is anybody new to my masterminds? Anybody not been to one before?
I've not been to one before.
Not been to one? Perfect.
I've not
No
been to one
worries.
before.
Great stuff. Good. A few kind of new faces there.
I think
Fantastic,
I
guys.
watched part of your tendinopathy one. I can't remember what happened, but I couldn't see it all.
Okay, no worries at all. No worries at all. Well, lovely to have you here, guys. Now we kind of always say at the start of these that there's lots and lots of info that we tend to go through, and especially in these kind of specific seminars. So we're at the moment we're looking at kind of anatomy, and it's not just for the sake of teaching you guys anatomy. It's anatomy with the kind of focus on the kind of muscles and joints and all that sort of thing that are moving and working when you guys are doing your resistance training. Okay, and we've kind of broken it down to be quite specific to that. So it should hopefully be quite useful for you training wise. We'll have a little bit of chat about that soon. But lots of info. We are not expecting you to remember all of it. We go through a few kind of basic concepts, which these are the kind of bits, and I'll highlight those as we go past that I want you to do your best to remember, but honestly, do not stress if you can't, right? It's lots and lots of info. There's no specific reason unless you've got some sort of job or profession that kind of covers that. There's no reason why you'd know that stuff, and it does take a while just to kind of pick that up. Okay, it's a lot of info. If you know something at the end of the session that you didn't know at the start, I think that you are in a better position than you were at the start. Okay, that's literally all that we want to get out of it. Okay, now interrupt me as we go through. Please ask questions as much as you want. I'm going to be asking questions to the group, but I'm not going to be picking on anybody. Okay, so I'm not going to make anybody talk or make anybody answer. So don't stress if you are stressing about that. But if you do want to participate, I think that generally kind of helps with learning, all that sort of stuff. So if you do want to kind of ask questions as you go, I would definitely kind of welcome that, and it keeps everything nice and interactive. Okay. Anybody, any questions before we crack on? No, fantastic. All right, guys. So what we're going to do, we'll just have a little bit of a kind of recap. Okay. So last week we kind of started looking at upper body anatomy. So we're going to fly through the first bit. Okay, and that's just a little bit of a recap on what we did last week. Now, don't worry if it's kind of going too quick. We will kind of slow down for what we're covering tonight, and it all will come round again. So you can obviously watch this one on catch up if you want, but you can also just keep coming to the masterminds, and this one will come round again eventually. And it's often, so those of you that have been to the same seminar a few times, it's often through doing that we kind of really start to kind of click with this stuff. So it's often through repetition that it really kind of sinks in. So don't worry, you're covered either way, guys. So why learn anatomy? I think the kind of reason that it can be useful for you guys, we're not just teaching it for the sake of it. We're teaching kind of a very specific section of anatomy that will help you guys with your training and resistance training and lifting. So you're going to understand how to kind of target specific muscle groups. Okay. Going to understand where those muscle groups are, what they do, all these sorts of things. I think that's very useful when it comes to training. You'll be able to assess kind of which joints, which muscles are involved just by looking at a movement. So who has seen an exercise, they've no idea what the exercise is? Yeah, I see that all the time. Okay, I'm a physio and PT with well over a decade in the fitness industry, right? And I see new exercises I've never seen before. But I can look at them and tell you what's going on and what's working and all that sort of thing. Okay, and that's, to me, that's far more useful than actually just memorizing names of stuff and memorizing lists of muscles that it works. If you know how the muscles work, you'll have a really good idea of how that is kind of applicable to your training. Means we don't have to rely on these kind of weird cues. You've probably heard me say put your shoulder blades in your back pockets or something along those lines before whenever we're doing a row exercise. If you don't already do that in your row exercise, start doing that whenever you pull back, shoulder blades in the back pockets, yeah. But it kind of means that you also understand that when we're saying shoulder blades in the back pockets, we're also meaning to contract your traps, your rhomboids, your lats, all these sorts of things. So if we understand that as well, that helps us have a good kind of well-rounded understanding of the exercise. So it's not saying the cues are bad, but that in as an adjunct to understanding what's working, I think is a very useful thing. And every single person is different. So it's daft to think that every exercise should look the same for everybody. It's going to look different for each individual. So if you understand what boxes you're trying to tick with the exercise, then you will be able to adapt that exercise to better suit you. Okay, I've got some machines that I use at the gym and I don't really sit on the seat that's provided, and I kind of set it up a little bit differently. There's one machine that I sit on backwards to the way that you're meant to sit on it, because it feels better for me and it's still ticking the same boxes. So there's all sorts of little kind of tweaks that you can make based on that, essentially based on something that feels better for you, provided you know what boxes you're trying to tick with it. Okay, and as always, guys, I kind of add that last one, and you can let me know whether or not that's the case or not by the end of the session. Okay, cool. So we'll stay nice and kind of slow through this bit, and then I'll speed up for the kind of recap. But these are the main concepts of your anatomy, your muscles, your bones, these sorts of things. So if you kind of pay attention or memorize any of the mastermind tonight, this is the bit that I recommend kind of really noting down. So when a muscle contracts, what happens to that muscle, guys?
It shortens.
Exactly, yeah, it shortens, yeah. Which means what force is applied to everything that it's attached to?
It's pulling.
Pulling, exactly, yeah. So the pulling force on everything it's attached to. Okay, so if we've got a rope between two objects, okay, and that rope shortens, it pulls those objects toward each other, yeah? Okay, if we've got a rope between two objects, but one is just fixed in place and it can't move, then what happens?
Nothing.
What about the other one?
Pulling against the one it's attached to.
Yeah. So if we have a rope between two objects, okay, so say I've got a rope between my two hands here, okay. Now if that rope shortens and these objects are exactly the same, it's going to pull them toward each other like that. Okay, so they'll both equally move toward each other nice and symmetrically. Okay, if one of them's fixed and it can't move, we'll just get this one moving.
Yeah.
Yeah, so that's all I mean.
Yeah.
Now, if we get that concept, you get how joints work, you get how muscles work. Okay, so we want to think of them as levers and pulleys. Okay, your muscle is attached to your bone via a tendon. Okay, so you'll have heard of tendons, or if you've been in the tendinopathy seminar, you'll have probably heard too much about tendons. Okay, but it's the bit that attaches your muscle onto your bone. Okay, so we just think about it like levers and pulleys. So the levers are your bones, and the pulleys are your muscles. Okay, and the axis are your joints. So the muscles aren't attaching to joints, they're attaching to bones. The joints just happen to be a freely movable bit. Okay. So if you were to open a door, you wouldn't reach into the hinge to open it. You'd grab the door and open it, or you grab the door handle and open it. Okay. But it's the hinge that ends up moving. So if I am bending my elbow, okay, that means that my muscle has to have reached across my elbow in order to move it. Okay. If my muscle didn't reach across my elbow, there's no chance of it being able to move my elbow joint, because it's not reaching the thing on the other side that moves. In the same way, if I don't touch my door handle and pull, my door's not going to open because I'm not touching it, right? It's exactly the same kind of concept as that. So levers and pulleys, the muscle gets shorter, everything it's attached to gets pulled toward each other, and stuff that can't really move won't move, which means you can figure out the bits that will move. Make sense? Yeah, cool. So if that's all you remember from tonight's seminar, I think that gives you a lot of really kind of useful info whenever it comes to kind of muscles, bones, anatomy, all that sort of thing. Okay, that gives you a really good head start there, guys. Cool. So I'll speed up a little bit now. We'll go through what we looked at last week. So last week we looked at the elbow joint, and we looked at the shoulder joints, and we looked at all the stuff that moves those joints. Okay, so first of all, we look at joint movements. Okay, so elbow can flex and it can extend. Okay, we have got your bicep and tricep muscle here. So bicep is this guy, tricep is this guy. So the bicep crosses over the front of your elbow. That moves it forwards, and that's flexion. And your tricep moves over back of your elbow, and it causes it to extend. That's extension. Now, does your tricep cross over the elbow?
Yes.
Yes. Why do we think it crosses over the elbow?
Or it won't be able to pull up the forearm.
Exactly, yeah. It wouldn't be able to do anything if it didn't cross over the elbow. It couldn't extend the elbow, right? Absolutely. So even though it's kind of hard to make out, you don't need a picture you can just use the knowledge that you've just gotten, which is a muscle can only move a joint if it reaches across that joint and grabs the thing that's on the other side. Yeah. Perfect. So flexion and extension, these are the two things, flexion, extension that your elbow does. That movement here of your, what looks like your wrist, that's technically an elbow movement as well. Okay, because if we actually grab your wrist here, all of a sudden you can't actually move it anymore. Okay, so it's not the wrist that's rotating, not this bit, it's the bones that rotate around each other, or more specifically your radius here, this bone that rotates around your ulna, which is this bone that ends up in that little pointy bit of your elbow, your olecranon. Okay, so that's the elbow joint, nice and straightforward, right? And bicep and tricep stuff is the main muscles that you're going to be using at that joint. This looks kind of complex, it kind of is. Last week we looked at glenohumeral joint, so that is your shoulder joint, which is a ball and socket joint. It's the joint between your humerus, your upper arm, and your shoulder blade. Okay, now if we look at that joint, you would say it's a fairly freely movable joint, yeah?
Yes.
Yeah, absolutely. Yeah, so it's a ball and socket joint, lots and lots of motion available at that. Okay, if we move our shoulders around, okay, we've got way more range of motion than we've got at the elbow. Yeah, elbow we've got 1 and 2, and that's kind of it. Right, shoulder we can do all sorts of stuff. All right. So we can split that up into a few different movements here. So we've got, and you can all do this one with me. So we've got abduction, which is this.
Yeah.
Okay, we've got adduction, which is just the opposite direction. Okay, so that means that anything in this direction, so even if I move from here to here, that is still abduction because it's part of that movement. Yeah. So adduction is coming down the other way. And we've got horizontal extension, which is coming this way.
Yeah.
Sorry, I made that absolutely incorrect there. Horizontal flexion, guys, which is coming this way, and horizontal extension, which is coming the opposite way, coming backwards. Okay. And we've got vertical flexion, which is coming up in front, and vertical extension, which is coming down, and it kind of continues. So that's your vertical extension when your arm comes up behind you there. Okay. Now, we also have rotation. Okay, so that is rotation of the shoulder joint there. Okay. Now, all of these movements, they are categorized, but we're not robots. So we don't just go through, abduction, horizontal flexion, internal rotation. We don't move like that, right? We move quite freely, and it tends to be a combination. These are just categorized to make people like us find it easier to describe different positions, essentially. But ultimately, our shoulder joint is a very freely movable thing, and we're going to discover just how freely movable it is tonight. These are just kind of categories of movement, just so we've got a decent idea of what's going on. Okay, that's your rotator cuff. Don't worry about memorizing the individual muscles. Okay, we're looking at, if you imagine, I'll stand up for this one. If you imagine you're looking straight at me, okay, and you're looking straight at this shoulder blade here, okay, so if you couldn't see my pec, you couldn't see any of the kind of muscles in front of it, you couldn't see any of the organs, any of the rib cage, anything like that. If you're able to look straight through, you can see the underneath of my shoulder blade on the other side of me there. Okay, that is this one. Okay, and then if I were to turn around, now you'd be looking at the other side of your screen, but you're still looking at this shoulder blade on me. Okay, so that's how that's oriented. So lots of little muscles that come up off the shoulder blade, and they hug round the top of your humerus, and they hold it in place quite nicely, and they generate different kind of rotational movements. And most importantly, because they're able to do that, and because they've got a really good grip on the head of the humerus there, they're able to really stabilize. Okay, so really deep muscles. They will be working hard with any shoulder movement you do. So if I ask all of you guys to do a shoulder movement, do any movement. Yeah, perfect. So that's the one. So we've got a few different movements there. Now, some of you did that. Okay, that's not actually a shoulder joint movement. That's something else which we'll discover tonight. Okay. But shoulder joint, the one that we just looked at, so abduction, adduction, internal rotation, external rotation, flexion, extension. These movements here, we know that we've gotten a really big activation of rotator cuff muscles one way or another during every single movement that you could do at your shoulder. Rotator cuff will be working, which is why if you've got an uncomfortable rotator cuff, it's pretty uncomfortable during nearly every movement that you do at the shoulder, one way or another. Okay. So because of that, if we get a tear in the rotator cuff, it's a bit like a hole in the sock. instead of like a kind of more like a rope structure like you see with a lot of tendons. Okay. So back to this picture, but thinking about the shoulder, bicep is at the front, so it moves it forwards, which is flexion. Triceps at the back, so it moves it backwards, which is extension. Okay, so nice and straightforward there. Lats do loads of stuff. Okay, big muscle that we're looking at this person from the back. They're attached to loads and loads of vertebrae here. Okay, they do a lot of work at the joint that we're going to be looking at tonight, but they also work at the shoulder joint. Okay, so they bring your arm to your side from wherever your arm is. Okay, that's the easiest way to remember your lats. And then whatever movement you did, that was that movement, or that was lats involving that. Okay, so if you put your arms somewhere, put each arm in a different place. Okay. Now, imagine you had some sort of force that was holding your arms there, okay, and you had to actively pull against that force in order to bring your arms to your sides. Okay, your lats would have done that, as well as some other muscle groups most likely, but your lats would have been involved. Okay, so that means that if we're in this position and you contract your lats, your arm comes forwards. But if we're in this position and you contract your lats, your arm comes backwards. If we're in this position, you contract your lats, it comes downwards. Okay, so instead of saying your lats do flexion from an extended position, and extension from a flexed position, and adduction from an abducted position, and all this nonsense, it makes it much more straightforward if you just say they just bring your arms to your sides from wherever your arms are. That make sense?
Yeah.
Okay. So now we know why lat pull downs get their names. What are you doing? You're bringing your arms to your sides. Okay, this bit of your arms. Okay,
Yeah.
Arms to the sides, and that's how your lat pull down gets its name. Which means if you're doing your lat pull down and you're bringing that bar down in front of you here, that's not the specific part of the movement we want to be focusing on. So we just think about bringing your elbows to your side pockets for your lat pull down. Yeah. Cool. So pecs, muscles at the front here. Now, if we see the direction of the fibers, muscles contract with something called a sliding filament theory, which is where we've got kind of, it's a little bit like interlocking fingers. So you can kind of see the grain of the muscle. Okay, we can see it in all of these muscles here. Okay,
Yeah.
You can see that grain. Now, this is horizontal. Okay, now they're at the front, which means they're going to be doing flexion. Okay, because we've got horizontal fibers, what sort of flexion do they do?
Horizontal.
Horizontal, right? So pecs are doing this movement here, so horizontal flexion. They basically, if you were to put your arms right about kind of here-ish, that's your pecs in their shortest position, pretty much. Okay, now if you put your arms anywhere, and then imagine that you had to bring, so I've got my arms in two different places here, if I had to bring my arms back to that position, okay, against resistance, my pecs would have been responsible for that. So whether that turns out as flexion, adduction, horizontal flexion, is your pecs that are doing that. Okay, and again, this is a really nice example of, you see how it's attached to your sternum and then it's attached to your humerus. Do you remember our analogy of the rocks, and one of them can't move and the other one can? Okay, your sternum's not going anywhere. Can everybody wiggle their sternum for me? Right? Not really, right? So we
No.
can't, even if we tense the pecs, the sternum's not actually going anywhere, right? So if we've got a fused bone and then we've got a non-fused, or a fused joint, and we've got a non-fused joint, it's the non-fused joint is the one that moves. Okay. Now deltoids, nice and straightforward. This is the muscle that is on the outside of the shoulder. That's what gives the shoulder its kind of round look there. Okay. You have kind of three parts to your delts, or three main parts to your delts. Well, that's how it's usually depicted anyway, which are your front, okay, front, side, and rear. And delts do not try to trick you. The front delt moves it forwards. The side delt moves it where?
Sideways.
Sideways, yeah. And the rear delt moves it
Backwards.
backwards, exactly, yeah. Okay, so nice and straightforward. So front delt, forwards, side delt, sideways, rear delt, backwards, okay? Or flexion, abduction, and extension, okay? Also, any sort of flexion will be front delt doing its job. Yeah, any sort of extension will be rear delt doing its job, whether it's vertical or horizontal. Okay. Now, if you look at that picture there, can you see a nice, clear three different parts to that muscle?
More or less.
More or less.
Certainly see two clear parts.
Yeah.
Front bit.
Yeah,
I can see.
absolutely. Yeah.
Yeah.
So if you can see three clear parts, you're doing better than me anyway. So it's your deltoid, it's often kind of summarized as having three parts to it. and we can quite clearly see your kind of like posterior delt fibers here, to be fair, which I think is what you guys were referring to there. But you have something called, or something around kind of 19 different muscle spindles within your deltoid. So there's no point us kind of saying, right, this is front delt only. It doesn't work like that. Okay, we've got loads and loads and loads of different parts of it. So whichever direction we're moving, we are using that rough portion of your deltoid. So just think of it as like a general kind of that sort of area is contracting instead of your side delt only is contracting, because it's not as simple as just 3 sections that contract separately.
Are you saying that
Okay.
they kind of all overlap?
Yeah, loads and loads of muscle spindles there. Okay.
Mm.
So whenever we are pushing forwards, we're using the the front fibers of the deltoid. So most of the fibers that are at the front. It doesn't mean we're not going to get a little bit of activation. So see if you guys all kind of if you push forward against your desk or against your wall or something like that that's in front of you, something that gives you a bit of resistance on pushing forwards, and you feel your shoulder, you'll feel the front is quite tense and tight. If you feel the side, it's also probably quite tense and tight. And as you come round the side, you'll feel that it slackens off a little bit as you come to the back.
Yeah.
Okay. But it's like, if you imagine it like the bit in the middle is like lit up red, and then the bits on either side of that will be kind of lit up pinkish, and then that'll kind of fade as it kind of comes out. So it's just depending on the direction you're moving, that'll depend on the kind of fibers that are being used. And the same is true of pretty much every muscle that we look at. Different fibers will be kind of working depending on what we're doing. Okay.
Okay.
You get the rough idea there, guys. So that brings us to tonight's seminar. Okay. Everybody happy so far?
Yeah.
Yeah.
Okay, any
Yeah.
questions so
Thank
far?
you.
Oh, fantastic. So we're going to look at what's called the scapulothoracic joint, or sometimes called your scapulothoracic junction, because it's not really a true joint. Okay, what is your scapula?
Shoulder blade?
Shoulder blade, absolutely. What's the kind of thoracic region?
Chest?
Chest, yeah, that's in it. Yeah, absolutely. Kind of everything that's kind of in the rib area. Okay, that all the way around is your kind of thoracic region there. Okay, so it is the junction between your shoulder blade and the back of your rib cage there. That is your scapulothoracic joint or junction, and that's what we're looking at tonight. Okay.
Yeah.
Cool.
Yeah.
What else can you see there, guys, in that picture? Clavicle, what's that?
Collarbone.
Collarbone.
Collarbone, absolutely, yeah. And humerus, we've just looked at. What's the glenohumeral joint, otherwise known as?
Mm.
What's that?
Chin.
Shoulder?
Just your shoulder.
Shoulder joint. Yeah, yeah. I promise I'm not trying to trick you guys. Yeah, there you go. Yeah. So glenohumeral joint, shoulder joint. Okay, so that is the ball and socket joint that makes up your shoulder. Okay, shoulder girdle is kind of talking about everything that's there. Okay, we can see it's a little bit of a kind of complex structure. Okay, so we have a very movable joint attached to another movable thing, which is your shoulder blade that moves around a lot. Okay, and we'll talk through that just now. So
Is that why it's so complex when somebody has a severe injury involving all that area?
yeah, absolutely, yeah.
If you break the very top of your humerus or something.
Absolutely, yeah. The more kind of movable parts we've got, the more complex it becomes. So yeah, definitely. Like if we are doing an assessment of somebody's shoulder, or if I'm assessing somebody's shoulder, I would look at, oh, no cheating, Leon, I can see that there. That's, you're going to memorize all the way through. So yeah, if we assess somebody's shoulder, I tend to look at kind of cervical range of motion. So we look at the neck. I tend to look at thoracic range of motion of the spine. We look at the shoulder joint itself. We look at the scapulothoracic joint, which is what we're kind of looking at tonight, and then various other things in the area, and then obviously all the nerves that kind of come down there and into the arms as well. So it's a really kind of complex structure, and this is like the assessment is relatively brief. Essentially, whenever we kind of really get down into how complex it is. So yeah, it's certainly a tricky one. Cool. So everybody elevate your shoulder blades for me. That's the one. Yeah, and this is the question that you get right, even if you don't know the answer. Because you shrug. Yeah. Yeah, exactly. Okay. And can we push these shoulders down. Okay, what's that called?
I can't.
There you go.
Depression.
Depression. Yep, absolutely. Okay. So elevation, depression. Can we retract the shoulders? The shoulder blades, I should say.
Pull them back, pull them back.
That's it.
Yeah.
Very good. And then protract is pushing forwards.
Protract. Yeah.
Yeah. Good.
So when I do Pilates, my instructor says, keep the can of Coke between your shoulder blades.
Okay. Yeah. So they're getting you to retract there. Yeah. Yeah. Perfect. Cool. So these are the main movements that we've got here. Okay, this is a fancy name, and it doesn't really have to be because it's a relatively straightforward concept. It's a complex area, but it's a straightforward concept. So scapulohumeral rhythm is a fancy name for saying that your shoulder blade moves in tandem with your shoulder joint. Okay, so we can see here that the shoulder blade has kind of rotated up by 60 degrees. The shoulder joint has abducted by 120 degrees, which means you get 180 degrees of overall movement. Okay, so they both move together. Okay, so if I just move my knuckles here, okay, my fingers only go so low. If I move my other knuckles, my fingers get lower. If I move my wrist, my fingers get lower. If I move my hand, my fingers get lower. Okay, so the more moving parts we introduce, the more overall movement we get. Okay, now your shoulder joint moves together with your shoulder blade. You can't really isolate one or the other. This initial bit here is pretty much just shoulder joint. Okay, and when we start to move past this bit, okay, and we start to move up, the shoulder blade moves as well. Nothing you can do about that. Okay, nothing you want to do about that. It's a useful thing. That's why we can move our shoulders so much. Where's the other ball and socket joint? Say again.
Your upper body,
Oh, in
your elbow.
Elbow is more of a hinge joint. I think somebody said it. It's in lower body.
Hip.
Hips. Yeah,
Mhm.
absolutely. Hips. Yeah. So that's your other ball and socket joint. We don't have as much motion available at our hips as we do at our shoulders, right?
No.
No.
Okay, we'll look a little bit mad if we did. Yeah. Okay, that would be some interesting dance moves you could do if you're able to move your hip that much, right? That's because we don't have that extra movable part there. Okay, and it's a different structure, right? It's not exactly the same, but you can imagine if we fix that shoulder blade, we get far less actual movement. Okay, so let me move that one on. Now that was a nice video that unfortunately doesn't work anymore, so you're just gonna have to take my word for it. So we have a shoulder blade that moves in tandem with your shoulder joint. So if you imagine this is the kind of shoulder blade, it comes out, and then after we pass this point, the shoulder blade kind of comes up with it. Okay, which means that we've got a kind of forced couple relationship between abduction and elevation, adduction and depression, extension is coupled with retraction, and flexion movements tend to be coupled with protraction. Okay, so the shoulder blade is just following it around in the same direction it's going. Now, some of you may know the name of that. Don't say it if you do. Some of you may have been smart enough, like Leona, to take a little picture of the movements that we were looking at before, because it says it on that. But if you missed that, then we'll find out in a wee second. So before we figure out the name of this muscle here, we're going to figure out what it does, because I think that is a kind of useful skill to have, and that's what we said at the start. We can use that knowledge. We can look at a muscle we didn't know we had. We can look at what it's attached to and figure out what it does. Okay, so your shoulder blade is in underneath this stuff here. That little bone you can see there is a kind of ridge that's on the back of the shoulder blade. Okay, so we can see this tendon here is attaching onto the shoulder blade, yeah?
Yeah.
Okay, same on the other side. And it's attaching onto your spine. Okay, now your spine does move, but not a whole lot. And if we look at the direction of those fibers, especially this bit here, what would you say the direction of those fibers is?
Almost horizontal.
Quite horizontal, yeah. So if it's attached to two objects there, so we've got an attachment on the shoulder blade, okay, which we know can glide about a little bit, and it's attached to the spine. How much sideways localized movement are we going to get at the spine?
Very little.
Very little, if any, yeah. So very little kind of, imagine this is your spine, we're not going to get that little kind of sideways movement of one of your vertebrae, we hope anyway. So in that case, even if the muscles, so if the muscle contracts and pulls on everything it's attached to, what's going to move? Shoulder blade. Okay. Where's the shoulder
Yeah.
blade going to move?
Towards the spine.
Towards the spine. Absolutely. What's that called?
Retraction.
Retraction.
Retraction. Absolutely. Yes. So retraction is when we pinch the shoulder blades back towards the spine. Okay. So we can look at a muscle and we can figure out what it does before knowing what it's called. Okay. Now, do we see that every kind of fiber there is going in the same direction, or is it going in different directions?
Different
Some
directions.
going up to the neck.
Different directions.
Different
Yeah.
directions,
At the
absolutely.
top
So
and the
we've-
bottom, they change direction, don't they?
Yeah, absolutely. They're kind of moving like that, aren't they? Right. So we've got some horizontal fibers in the middle. Okay, we've got some vertical fibers coming up towards the top, or more vertical fibers, and we've got some kind of more vertical, but in the other direction, fibers going down towards the bottom. So with that in mind, do we think that it does just one movement, or perhaps a few movements?
You.
Absolutely.
Oh,
So we've got kind of three main directions there, which means it does three main movements. Now we've got that middle one away, so that middle one was retraction. Okay, the ones at the top pointing upwards pull the shoulder blade in what direction?
Towards the base of the skull.
Upwards, absolutely.
Up.
Yeah, towards the base of the skull. So what's that called?
It's,
Elevation.
Elevation, absolutely. Yeah,
Yeah.
think of an elevator for that one. Yeah, elevation. So pulls them up. Okay. Now, ones at the bottom, what do they do?
Pull it down, depression.
put down.
Depression,
Yeah.
absolutely. Yeah, perfectly. Yeah.
Depression.
So they depress the scapula. Okay, that kind of makes sense, right?
Yeah.
We can figure that out. So we've looked and we've kind of seen everything that does without really knowing what it's called. Some of you may not. Now, just whilst we're here looking at it, we'll tell you a couple other things that it does. So you can kind of see where it's attached there. We think it's going to have a little bit of an effect on the spine. So whenever we do retract, or we do like contract that muscle, it tends to pull us back a little bit as well. Okay. So you'll actually find that if you round your spine, so if you kind of round forwards and look down a little bit, see if you try
Yeah.
and pinch your shoulder blades back, but maintain that forward rounded position, you'll really struggle.
Yeah.
Okay,
Yeah.
so it's kind of coupled with
Comfortable.
that spine extension. So as you straighten up, you can pull your shoulder blades together much easier.
Mm.
Okay, so these things are all kind of linked together. Okay, so what's it called?
Big muscle.
Big muscle, yeah, definitely. Not the lats. I think someone said lats there.
Is
Not
it
the lats.
trapezius?
Yes,
Trapezius?
trapezius. Yeah, well done. That is your trapezius we're looking at there. And it's quite a superficial muscle. It's right on the surface. Okay, so it's right up top. Those of you that were thinking lat, your lat is this muscle here that we can see underneath it.
Oh yeah, yeah. Of course. Sorry. Yeah,
No,
yeah.
no, oh, good. You're in absolutely in the right sort of region.
I confess to having been a nurse, so some of my anatomy is coming back to me.
Ah, perfect. That's good. Yeah. Maybe I will pick on you then. We'll see.
No, please
Yeah.
don't pick on me. I'm retired. I'm 70. I've forgotten
Okay,
more that
yeah.
I remember.
Cool. That'll be a nice little refresher then. Cool. So now what are we looking at?
That's your lats.
The lat.
The lats, absolutely. Yeah. Okay, so we know what they do at the shoulder joint. What do we think they do at the shoulder blade or the scapulothoracic joint? Are they above or below?
Below.
Yeah.
Okay.
Do they pull them down?
Exactly. Yeah. So it just pulls it down. Okay.
Mm.
Now, you can get, I believe some people have attachments on the shoulder blades from the lats and some people don't. Okay. You can have like a little bit of variability there. But if you imagine something holding onto your arm here, which your lats effectively do, so they come up your back here. Okay. They come through the armpit and they grip onto the kind of front of your humerus here. So that's why it's kind of moving away from us. We can't see the attachment there. If you were to kind of grab your arm here and contract and pull it downwards, okay, you can see how that pulls your shoulder blade down as well.
Mm.
Okay, so it's crossing over two joints there, and it does a very similar thing at both. And we said as well, so adduction, we can see how that would be definitely a lat movement, and also how that would be very much linked to depression. Yeah.
Yeah.
Cool. So that's your lats. Now again, attached to your spine. So it's more of a kind of stabilizer than anything else at the spine. It does lateral flexion if you contract one lat at a time. So if you contract your right lat, it'll flex you to the right.
Yeah.
not flexion the other direction. Okay, so it's responsible for lateral flexion. Out of all of your core musculature, your lats cover the largest number of vertebrae. Okay, so it's a really important spinal stabilizer. You've got a big kind of tendinous sheet at the bottom here that we have lots and lots of different attachments within, which is called your thoracolumbar fascia, which is a little bit of a mouthful. So a big tendinous kind of sheet down here. Okay. Now, we may not know the name of this, some of you may, but let's figure it out without looking. These fibers here, are they, well, is this muscle above, below, or level with your shoulder blades, more or less?
Level.
Level with,
Level.
okay. So we can figure, even though it's kind of pointing a little bit up, because it's not really above them, okay, we know that it's probably not upwards that it's going to move them, okay? I can only pull something upwards if I'm above that thing. Yeah. So with that in mind, what are they going to do to your shoulder blades when they contract?
Pull them together.
Pull them,
Pull them.
yeah.
Pull them together, right? Absolutely. So what's that called?
Retraction.
Retraction, absolutely. So we're looking at what muscle group? Anybody know?
Are they the rhomboids? I don't know. I can't remember.
Yeah, rhomboids. Well done. Spot on. So we're looking at rhomboids there. So they are running underneath your trapezius. Okay, so we can't see them on that other one because they're underneath it. Okay, just right in there. Cool. So pecs we've looked at before. Okay, pecs bring your arms forwards, which means what do we think they do at your shoulder blades?
Move them apart.
Yes.
Pull
They
them apart,
move
absolutely. Yeah, so they come
Yeah.
apart and they come forwards. And what's that movement called? That was correct. Yeah.
No,
Someone was-
protraction. Yeah.
Yeah, absolutely. Yeah, I think someone else whispered protraction there as well. So spot on. Now this one is a little bit of a mouthful. Before I tell you the name of it, it is running. So we're looking at this shoulder blade right from the side. So we're looking at the outer blade of the shoulder blade. Okay, we've got kind of a chromium process just here. We've got coracoid process just here. That is the glenoid fossa, it's called, which is the socket basically that the joint kind of sticks into. Now we can see that this comes right underneath that shoulder blade. Okay, so if we've got shoulder blade, we've got rib cage, that muscle's going right in between the two, and it's attaching onto the inside edge. So it's attaching actually onto the same edge as the rhomboids here, but it's underneath and it's traveling around the side of the ribs. Okay, now can you move your ribs around for me, guys?
Well, only when you breathe in and out.
Not-
Does this
not
allow
really.
expansion of the rib cage when you're breathing?
It will have a little bit of kind of respiratory effect, yeah, but it's quite a strong something else. It does something else. It's attached to the shoulder blade and then it's attached around in front of the shoulder blade. So what do we think it does?
Pull them forward.
Yeah, pulls forwards. What's that called?
That extension.
So you're thinking shoulder joints, I think shoulder
Oh.
blade. So we've got elevation, depression, retraction, protraction.
Yeah.
Protraction.
Protraction.
Protraction, yeah, absolutely. So there's a really strong protractor of the shoulder blade. It's a really good stabilizer of the shoulder blade. It helps to kind of keep it nice and glued onto that rib cage there. So yeah, protractor, or the boxer's muscle. Okay, so we can see it right there. Okay, that's not ribs. That's the boxer's muscle or your serratus anterior. Okay. Yeah, serratus anterior. Now we can see a bunch of other muscles because this guy's super lean. So we can see this muscle here. What are we looking at? Pecs, absolutely.
Yeah.
And we can actually really start to see the direction of the fibers within that muscle quite clearly there. Okay, because he is a lean guy. Okay. Now muscle here. What are we looking at? Biceps, absolutely. And someone said triceps. We're looking at the triceps just back here. Now we can clearly see there how the bicep is coming up, and we've got that head on the inside that's coming right up there, coming right into the armpit over the shoulder. Okay, so it comes up really quite high. What's this muscle here?
Deltoid.
Deltoid.
Deltoid, absolutely, yeah. And yeah, so we're looking at front deltoid, maybe kind of into the kind of side fibers just here a little bit. Yeah. What's that muscle just there?
Part of the
Trapezius.
trapezius.
Yep, absolutely, yeah. So it's the kind of upper fibers of the trapezius that we're looking at there. Yeah, perfect. What muscle are we looking at just here?
Oh, is this the serratus anterior one?
So you're absolutely right that that is that one. What are we looking at?
Yeah.
What brings that bit of
Oh,
kind of
that's your
tissue
lats.
out to the side?
Ladder?
That's the lats. Absolutely, that's the lats. Yeah. Okay, so we can see that really big muscle right coming up and into there. Okay, so nice and easy to see lots of muscles when someone's super lean like that, which is very useful of them. Okay, cool. Everybody happy with all of the above?
Somewhat.
Yeah,
Yeah.
fantastic. Okay. So we're going to have a look at some bench press. Now, we're not going to go into too much depth on kind of bench press technique and that sort of stuff tonight. If you do have any questions, please feel free to ask. But we're going to think a little bit more about the muscles that we've got working. Okay, so we'll play some bench press and just have a look at it. Okay, so when we figure out what muscles are working during an exercise, we want to look at what joint actions or what joints are moving. Okay, and then we look at, because we've got lots of different joint actions going on, so we look at what joints are moving, and then we look at what the joint actions are when the weight moves upwards, because that gives you the direction of effort. Okay, and then once we know what the joint actions are when the weight moves upwards, we just figure out what muscles are responsible for that joint action, and that tells you what muscles work during an exercise. So first of all, tell me only the joints that are moving. You don't have to tell me the action, but just tell me the joints that are moving.
Elbows and shoulders.
Your elbows.
Elbows and shoulders.
Shoulders.
Yeah, absolutely. And we're not actually getting a huge amount of scapulothoracic movement here, because we're kind of keeping the shoulder blades really glued down onto the bench there. Okay, or at least we shouldn't be getting that, because that doesn't help with your bench press. Okay, perfect. Okay, so what is the joint action then? Let's go elbows first. So what's the joint action when the weight moves upwards?
Extension.
Tension.
Extension, absolutely, yeah. What muscle group extends your elbow?
Your triceps and biceps.
Bicep.
And biceps.
Okay, so we had triceps and biceps said then. Now they do opposite things. Okay, so we're unlikely to have both working. So which one is extending the elbow?
Bicep.
The bicep.
Biceps.
Okay, hands up for biceps. Okay, can everybody show off your biceps for me? Okay, that's it. Cool. Now, what have you all just done with your elbows?
Hold them up.
We just bent them.
Bent them, yeah. Now, what are we doing on a bench press?
So
Stand.
it's the triceps we're
Triceps,
using.
yeah.
So
Absolutely, yeah, cool. But good biceps, those people. I like that. Okay, so bit harder to see on this one because we're only doing a portion of the range, and you often find that with the shoulder because it moves a lot. Okay, what is the shoulder movement that we've got going on when the weight goes up?
The front movement.
And
So
go to the side.
extension.
So it's a kind of
So it's sort of
front
coming
movement, yeah.
forward a bit, isn't it?
Forward a bit, Jackie. Yeah, absolutely. Yes, it's
Yeah,
coming
so
forward.
it's protracting a bit.
Now,
Yeah,
interesting one there.
it's
So
protracting.
we're looking at
Flexion.
shoulder joint as opposed
sorry.
to
Wrong one.
scapulothoracic joint. So yeah, you're close, but there's no protraction. There sometimes is when people do it wrong though. So you're absolutely right. Sometimes people will push the shoulders up off the bench like that. We don't want to
Yeah.
do that on a bench press, but you do often see it because those two movements go hand in hand. And so I think somebody else said it there. So what movement have we got?
Flexion?
Flexion, yeah, absolutely. And to be more specific, what sort of flexion? So is it vertical or is it more horizontal?
horizontal.
Horizontal.
A bit more horizontal, isn't it? It's
It's a
kind of like
bit more,
somewhere between. So it's not maybe fully here and in, but it's a little bit somewhere in between. And that's why it's always kind of hard with shoulders, right? Because they can do vertical and they can do horizontal, but they can also do everything in between. Okay, but it is a little bit more horizontal. What muscles do horizontal flexion?
The pecs.
The pecs, absolutely, yeah. Pecs do horizontal flexion. Okay. What other muscle is involved with every single type of flexion at the shoulder?
Your deltoids.
Your deltoids, yeah. And which bit is involved with flexion?
The front.
The front. Absolutely, yeah. The kind of anterior fibers there. Yeah, the front. Okay, so then if we look at a bench press, okay, we can figure out main movers are your pecs, your triceps, and your front delts. Okay, now out of all three of those muscle groups there, which one is the biggest?
Pecs.
Pecs, absolutely, yeah. So which one's going to be the most important for bench pressing? It's going to be your pecs. Okay, so if you've got a strong pair of pecs, you'll have a good bench press. Okay, the other muscles obviously do really help, but pecs are definitely the ones that want to be really good and strong. Okay, let's do one more. Right, quite a good one. We won't go through this one because it's actually the same in that we've got pecs, front delts, triceps working. It's the same movement, we're pushing forwards. But we notice in this that we actually have a little bit more protraction going on as well. Okay, so in a push-up, we actually get a really big activation of what muscle group? Funny name.
The rotor cuff.
Yes to that, but that would be the same for every kind of movement that involves the shoulder. So rotator cuff will be working quite hard. What was the boxer's muscle called?
Oh, the anterior serratus.
Yes, serratus anterior. Yeah, absolutely. Yeah,
Right.
perfect, Leona. Well done. So serratus anterior will work really quite hard whenever we're doing push-ups. Okay. Let's have a look. Yeah, let's do a lat pull down. Okay, now you can kind of guess from the name what muscle's working, but we're going to pretend that we don't know, and we're going to work through it properly. Okay, so what joints are moving?
Shoulder,
Elbow.
elbow,
Shoulder,
Shoulders.
elbow.
And elbows.
little wrist.
There'll be a little bit of wrist movement going on there, yeah, absolutely. But we've not covered the kind of muscles of the forearm, so we'll let you off for that one tonight. Okay, so shoulders and elbows, absolutely. Anything else?
Thoracic.
Yeah, scapulothoracic, isn't it?
Yeah.
Yeah, shoulder blade's going to be moving a lot there.
Mhm.
Okay. Cool. What do you want to start with? Pick a joint. Start with elbows.
Yeah,
Okay,
it's
what,
not with
what
elbows.
is the elbow doing whenever the weight moves upwards? Now, bear in mind, the weight is what you can see just in front of my head there in the machine. Okay, so if you keep an eye, you can see it in the machine moving up and down. So when the weight moves upwards, what's the elbow doing?
Abduction.
Standing.
Bending, isn't it? Yeah, the elbow's bending when the weight
Abduction.
moves upwards.
Biceps then.
Biceps,
Yeah.
absolutely, yeah. So Jackie, you're thinking more shoulder, so you're ahead of us there.
I
So we're just
am,
looking at
yeah.
elbow. So biceps working pretty hard whenever we do this, yeah. Okay. Cool. So let's go shoulders. So have a look at what the shoulder joint is doing when the weight moves upwards, not when my hands move upwards, when the weight moves upwards. So have a look in front of my head there into that little machine. Okay, you can see that weight moving up and down in it.
Go up
Shoulders
and
are coming down.
forwards.
Depress.
Okay, so are we thinking shoulder or are we thinking scapulothoracic? Which one do you want to do first?
Shoulder.
Shoulder. Okay, so shoulder, we know it's going to be either internal rotation, external rotation, abduction, adduction, flexion, or extension. Okay, it's not the
Okay.
elevation, depression, protraction, retraction. That's scapulothoracic, which we'll do in a wee minute. So what's the shoulder joint doing when the weight moves upwards?
Retracting.
Is it vertical extension? No, I don't know.
Yes, it is exactly that. Yeah, it's extension and a little bit of something else. So a bit of extension and a bit of something else. Can everybody do some? Oh yeah, perfect. Adduction.
Abduction.
Yeah, adduction. Yeah. So remember what we said at the start: abduction, adduction. Yeah. And if we look at adduction portion, see if I just bend my elbow as I'm coming down, right? That's the same, isn't it?
Abduction. Yes.
Right at the shoulder, that's the same movement. Okay, so we've got adduction going on. Okay, perfect. So adduction, so kind of extension, adduction going on. And we know that the lats are responsible for those things. Yeah, and we can see here, I'm pulling my arms to my sides. Okay, now a couple of you were mentioning a few kind of scapulothoracic movements there. So what is happening when the weight moves upwards? Is it elevation? Is it depression? Is it protraction? Is it retraction?
Depression.
Depression, absolutely. And the way I'm kind of performing this movement, there's a little bit of something else going on.
Shoulder blades are moving towards each other.
Yeah, so a bit of retraction as well. So we've got a bit of depression and a bit of retraction. What muscles depress your shoulder blades?
Your
Trapezius.
Trapezius, which bit of the
Yes.
trapezius?
is it the middle bit?
The bit that's down the bottom.
Not quite the middle bit, the bit at
The
the bottom,
lower
yeah,
bit,
the lower
the
bit.
bottom bit.
Absolutely, yeah, the bottom bit. Okay, so we've got lower traps that will be working, and we've got lats again that will be working, right? We said they're grabbing the arm and pulling that shoulder blade down. Okay, retraction, what muscles retract?
Got the rhomboids? No.
It is absolutely the rhomboids, yeah. Yeah, 100%. Rhomboids and something else.
That boxer muscle, that anterior state, no?
That is protraction as opposed to retraction. Yeah, yeah.
Lats?
Not so much lats. They don't do too much retraction, actually. But they look like they might, but they don't really from where they are.
Hmm.
So we've got lower traps that bring the shoulder blades down. What brings the shoulder blades back?
Upper traps?
Upper
Not-
traps.
So upper bring them up, lower bring them down.
Middle.
The middle one.
Middle, bring them
Middle.
back. Yeah, absolutely, yeah. Okay, so with your lat pull down here, we've got lats working pretty hard, and we've got your rhomboids and mid and lower traps working pretty hard, the way I'm performing it anyway. Okay, you can do it where you don't lean back as much, and then you get a little bit less kind of retraction movement. It's more just lats. Okay, it just depends how you perform it. Okay, now shoulders moving. If you see a shoulder moving, I probably know that there's another muscle group that's working quite hard.
Pecs.
Not pecs. Pecs will be a bit, to be fair. So from here to kind of here, your pecs will maybe be a little bit kind of tight from that overhead position. What muscle covers the whole shoulder?
Deltoid.
Deltoids, absolutely, yeah. And we've got a bit of a kind of extension movement going on. So that means which part?
The middle
Middle, maybe a little bit middle, but a little bit more
on the back.
on the back. Yeah, perfect, Alison. Yeah, so a little bit more kind of rear delt. Okay, so rear delt we can see is kind of bunched up quite tight just in the back there, yeah. Okay, so we can tell by looking at an exercise, okay, we've picked that apart and we've said what are the joints that are moving, what are the actions, okay, and what muscles are responsible for those actions. Okay, so nice and kind of straightforward. Okay, it takes a little bit of time just to kind of like pick these things apart, but it will just start to like click and you'll just look at it and know. Okay, perfect. All right, guys, I think that's plenty of that nonsense for tonight. Now, anybody have any questions at all?
Yeah, I do.
Mhm.
If you were doing your lat pull downs and you changed your hands the other way round, how does that change the muscles that you're using?
Absolutely, yeah. So it will be similar muscles. So all the muscles will be still working. We might change depending on where we end up, the kind of fibers that are working a little bit. Your lat is actually a kind of internal rotator of the shoulder joint. So see if we externally rotate as we're coming up, we probably put a bit more stretch onto the lats. So you can sometimes feel them a little bit more there, but then it kind of makes it a bit harder to get into that overhead position because of how your shoulder works. So different people will feel differently whenever they do it. One of the major differences that you'll notice whenever you bring your grip under is that your bicep is actually a kind of supinator. So I'm not sure if you can see through my hoodie, but see if I kind of turn like that, you can see the bicep kind of shortens a little bit as I'm turning up. Okay. So as we turn in like this, you'll feel the biceps kind of much tighter essentially as you're coming down. So these different grips on a lat pull down will make it vary slightly in terms of what muscle groups are working or to what degree the muscle groups are working or which bit of them are working. But ultimately, it doesn't really matter hugely because the difference will be minutiae. It will be negligible. Okay.
So just do whatever's comfortable for you, really.
Do what feels best for you, and I would suggest changing it up every kind of 6 weeks or so, and then doing it again. Okay, so I like to kind of pick 2 or 3 variations. So I like a kind of stiff arm pull down, so that's with like a straight arm like that. So I really like that one. I like a close grip one. That feels really nice for me. And then I like just pull ups as well. And so I tend to like just kind of swap between those 3 and just cycle them in and out.
Yeah. Okay.
Any more questions, guys? No, fantastic. Good. Cool. So if you do think of any that you want to ask me, or if you prefer to ask not in front of a group, then just pop it across to me on my WhatsApp together with any videos that you want to send me. If you don't have my WhatsApp, message your coach and they will send you my WhatsApp. And I'm away next week, but I will be back the following week, guys. So I will see you in 2 weeks' time. Okay. Have a lovely rest of your evening, guys, and I will see you very soon.
Thank you.
Bye.
Bye.
Bye, guys.
Good night.
Bye.
No.